Our film Pasa la Voz, Spread the Word, is a film that explores the lives of different Latina women who either work or live with HIV/AIDS in the Juarez and El Paso border town area.
Empowering the Yard looks at HIV prevention from the perspective of 5 incarcerated women who are using peer education as a tool for empowerment for themselves, their families, and their communities.
Our movie is about empowering women who are HIV positive.
Parent-child communication on the issues of sexual health.
Our film is about a diverse community of street-based survival sex workers in DC and the systemic barriers they face and their personal traumas.
In San Francisco State, with a very strong documentary tradition and with a very strong sense of social consciousness, I can't think of a better place in which to train students to actually develop areas of expertise dealing with social and health matters. It's the kind of course that I always tell people about when they say, well, what do you do there that's special or different or unique? And I say, well, this is what we do.
Students learn and things go into long-term memory when you present information in such a way that it not only has an intellectual charge, but that it has an emotional appeal. And film is a very good way to both present research and information, but then to make that research real.
The class is an interdisciplinary class where we bring cinema students and health education students or students from other departments together. They form teams. They then partner with a community-based organization and spend 1 to 2 semesters working with that organization to create a film that they can then use to educate and advocate for change.
So the Health Equity Initiative was created by San Francisco State University as one of the outcomes of its dedication to equity and social justice. Our role is to actually locate the talent on campus to address health inequities. We locate that talent through faculty, through staff, through students, and try to synergize that talent into creating real solutions.
So this year, our production course collaborated with the National AIDS Fund. Teams of our students traveled to Tulsa, Miami, Washington, D.C., New Orleans, and the El Paso Juarez area, working with local service providers to research and then design, shoot, edit, and produce short films on women in HIV.
I think, the biggest concern that I had going into it was, did we have the capacity to really pull this off in 5 different sites? This is the first time that we've done it, so there's always anxiety, I think, when you're doing a project for the first time and you've not collaborated with folks. I think other things were, was the group of students going to be able to really get it? Were they going to be able to learn enough, quickly enough about HIV, the nuances of the issue, and then also the social justice aspects of it?
I was just surprised how emotionally involved I was throughout the entire process of making this film.
I was surprised to see how much HIV still affects women.
I was surprised by the connection that I found with the women who I interviewed in prison, coming from really different backgrounds. I wasn't looking for that kind of connection, but I found it, and it was powerful.
I was surprised by how deep the interviewees talked about their personal lives with us, being total strangers.
I was surprised by how dedicated these women are to what they're doing and how they're trying to change their little part of the world.
I didn't realize that there was so much stigma attached to AIDS.
The stories are incredible. I can't believe that you were able to get that kind of detail and emotion from women that you've never met before. I think it was remarkable.
The great thing about it is that all of our fears or concerns have been completely melted away. The students have been amazing. Clearly, the professors prepared them appropriately. The pairing of health education students and cinematography students, I think, is a wonderful balance because it also teaches both of them about other issues. As I was talking to one of the young men today, he said, I had so many preconceived, notions about what working with these populations was going to be about. I didn't know anything about HIV. We had that first lecture from Dr. Gomez and we were all completely overwhelmed, but now I get it.
For me, this course is showing a lot of students, as well as the community, ways in which they can find a place in public dialogue and have their issues find a place in public dialogue.
This course is also about having a historical set of films over time that highlight the issues of the day, if you will. And so as years go by, 10 years from now, we look back at this series and ask ourselves, wow, have things changed? Are they still the same? Have we moved? So they become, in some ways, a barometer for achieving our own goals in health equity.
I wanted a couple of things, like,
It's been such a huge educational experience for the students. And for us, I mean, that's a win-win all around. If we come out with compelling social justice documentaries around women and HIV, and students have learned something, and at the end of the day, they take not just this product, but the learning that they've gotten from this process back into their other classes, into their communities, into their families, then we've accomplished far more than we could have ever dreamed of.
I learned how to use film as a tool for social justice.
In this class, I learned about the power of an art form like documentary film to convey a message of social justice that can't always be conveyed in academia.
I learned how much women are affected by HIV, in particular women of color.
I learned how HIV is prevalent in all communities and affecting everybody.
I learned how to work in a group, how to work in a team and create something really great and exciting and that helped the community.